Good afternoon, everybody. My name is Garrett Schmidt. I am the managing editor for ACO Exhibit Hall, and I'd like to welcome you all to today's live webinar, which is hosted by Mozaz and CVS Health Accordant Care, and it's titled Collaborating to Create Seamless Digital Connections that Transform Member Experiences. And I think we've got a lot of information to cover here. That's great. I got a little sneak preview the other day, and I'm very excited to hear from our speakers today. A couple of items of note before we get started today. Everyone has joined the webinar in listen-only mode, so you don't need to worry about muting your microphone or anything like that. We can't hear you, we can't see you, so just you can sit back and enjoy the presentation. During the webinar, we definitely want to hear from you, so please submit your questions at any time. Using your attendee control panel, there's a place where you can actually ask questions on there, not in the chat, but there's a little question module there. And we're going to get to as many of those as we possibly can during the allotted time today. If we don't get to yours, don't be discouraged. We will make sure to get back to you via email afterwards to answer those questions. So please, up until the very end, ask those questions. And you don't even need to wait till the Q&A to do it. You can ask that at any point. And then finally, today's webinar is being recorded. And so you'll have the opportunity to rewatch the session and share it with colleagues, and we hope that you do. So what's going to happen is after the webinar is completed, I'm going to actually send out an email to everyone and, a little later on this afternoon, possibly this evening, and you'll receive a link to the webinar recording, as well as a place where you can download the slides also. So feel free to do that. So at this time, without any further ado, I'm going to hand it over to Linda Lucis, and she's the VP of Strategic Partnerships with Mozaz, and she's going to introduce our speakers and get us started. So welcome, Linda.
Thank you. And thank you, everyone, for joining us. We have a great topic lined up. Condition Advisor collaborating to create seamless digital connections that transform member experiences. As Garrett mentioned, I'm the VP of Strategic Partnerships at Mozaz, and I'll be moderating today's webinar. Our two presenters today are Danielle Gaither and Larissa Aeneas Weiss. Danielle is the Senior Manager of Rare and Complex Product Development at CVS Health Accordant Care, and I've had the pleasure of partnering with Danielle and her team for over 2 years. Larissa is the Director of Product Management at Mozaz and works directly with the Accordant team improving member experience. Both of these women have expertise with healthcare solutions that improve experiences for both members and the care teams that they support. I'm looking forward to hearing from them today and sharing the details of our journey together. I will run through the agenda so those of you in the audience know what to expect, and then I'll pass it over to our speakers to get started. We'll start off with a little bit about Accordant and Mozaz. Then we'll move into providing next-level digital experiences, enhancing whole person support with digital health, helping patients stay in touch and out of the hospital. Quick and easy access heightens value for nurses. Condition Advisor digital member journey, harnessing the power of collaboration to enrich the patient experience. Then we'll have a live Q&A at the end of our session. With that, I'll move it over to Danielle.
All right. Greetings, everyone. Let's start off with a little bit of background on who Accordant and Mozaz is. Accordant Care offers payers a comprehensive patient care program. We have been providing whole person care, including comorbidity management, to members with complex and rare conditions for over 20 years. Using real-time pharmacy and medical claims data, electronic health records via Epic, and health plan and specialty pharmacy referrals, our nurses can identify plan members with complex conditions earlier and proactively provide support to better manage their whole condition through evidence-based intervention. The Accordant Care program is NCQA accredited in both population health and case management, and our programs go beyond just drug therapy. We counsel members on all facets of care. Through the use of Epic connectivity, our nurses have rapid access to comprehensive member data, enabling real-time notification and alerts. During the webinar today, we will walk you through our mobile app member engagement strategy that aims to engage, empower, and support enrolled members with rare conditions.
Thanks, Danielle. Hi, everyone. So who is Mozaz? Well, Mozaz delivers industry-leading patient-centric virtual care solutions, including tools for remote patient monitoring and patient engagement that improve patient outcomes, increase efficiency, and reduce costs. Our expertise is in creating personalized digital experiences that can be scaled across a patient population by leveraging our automation engine. We take a consultative approach to virtual care health technology and the digital care ecosystem, deploying everything from low-touch, configurable, remote patient monitoring to completely customized white label virtual care solutions, all on a unified digital healthcare platform. For Accordant, we work closely with Danielle and her team to understand their membership needs, finding meaningful solutions to their unique complex care and chronic condition challenges.
Thanks, Larissa. So in a world where there's an app for this, that, and everything in between, that does not really apply for the majority of our members, unfortunately. There's a mobile app desert for the management of our rare and complex conditions. In the marketplace today, you'll find very nuanced apps to support your larger conditions like HIV, RA, and MS. But there is little to no digital support for your more rare and complex conditions like scleroderma or myositis. In essence, the members that we're supporting, they need the most support. They are the ones that are most complex, but they're also the ones with the least amount of support and resources. That's why we are excited to offer our members a new digital engagement solution to help them manage their condition the same way we all live and work, digitally. With Condition Advisor, our mobile app, deep integrations and interoperability become key components to helping ensure the seamless data exchange between our members and their care team. The nurse-member relationship is the key to success for health outcomes, not just in our program, but just in general. But how do you keep members engaged and connected in such a fast-paced world that we live in today? Simple, right? By creating a comprehensive solution that will complement nursing interventions by delivering support via multiple channels, meeting the member where and how they want. The healthcare engagement landscape is changing. We know this. Members expect that they can get in touch with the healthcare team, their doctors, etc., via multiple channels. We know through extensive member research and direct member feedback that they're eager for these digital tools. They also want that phone option as well. And they want all of that combined to enable them to be the initiator of that communication. That then allows members to proactively improve health by advocating for themselves with a total approach to health and wellness. And it also allows them to reach out for help when they have acute needs, some symptoms that come up, or even concerns that they have. For example, a member can go into their rheumatologist on Monday, have a follow-up call with their nurse on Tuesday, and then provide updates and track values via their app on Wednesday. Our omni-channel approach supports this increased engagement with telephonic, mail, and digital tools to empower members and drive attitudes and behaviors toward better health outcomes. Coming off the past year and a half, we've all had to shift much of our lives to the digital world, including how we access healthcare. That trend toward virtual care will not go away. It will most likely continue, and we must be poised in the healthcare industry to provide those services. We at Accordant are uniquely positioned to engage with our members across various platforms, digital and telephonic touchpoints in a seamless way. Our mission has a three-prong approach: empower, support, and integrate. And by the way, make sure it's member-centric, enhances program engagement, connects the member to their care team to ensure positive health outcomes and interventions, and to ensure 100% epic connectivity. Easy peasy, right? This was no easy task, but with the help of our vendor partners at Mozaz and Epic, we have been able to close that gap in the mobile app desert for our members. The creation of this holistic digital platform that connects members with their care team on their time and in the way that they want is the center of our mobile app strategy. So without further ado, let me introduce you all to Condition Advisor. Condition Advisor is our private, secure mobile app that our Accordant members can use to help manage their complex condition and overall health. With Condition Advisor, our users can securely message and communicate with their nurse care team, complete online assessments, and track new or worsening symptoms, and much more. But the key to that is that it's anywhere, anytime, on their terms. Members can use the app to keep track of important vaccines and screenings, manage medications, schedule reminders, and receive notifications about clinical information like hospital discharge support and HEDIS reminders. With just a few clicks, our members are able to find reliable educational materials about their complex conditions and comorbidities. The Condition Advisor app is an exciting enhancement to an already robust care program. It allows members more freedom, more choices, and more help to confidently live their best lives on their terms. So let's take a little bit of a deeper dive into the robust features and connectivity that support our members and nurses. So I will be tag teaming with Larissa on these deep dives into the mobile app features. First up, we wanted to make sure that the user experience was as seamless as possible. So we made sure to make getting started with the app super easy. Members simply download the app, then use their Accordant MyChart credentials to sign in. All of their information is populated automatically, making enrollment and their digital engagement easier than ever.
Thanks, Danielle. So for Condition Advisor and Mozaz, the challenge we faced was how to authenticate Accordant members and connect to Epic, while at the same time ensuring new members could get started using the app quickly and easily. The solution we implemented includes single sign-on for MyChart members through the implementation of OpenID and OAuth 2.0. For members, they can enjoy the benefit of using their MyChart credentials to access Condition Advisor, meaning only one username and password to remember. For Accordant, they get the benefit of continued member authentication and consent management through Epic.
Research and direct member feedback tells us that members want the ability to connect with their care team with quick questions or updates. Who doesn't, right? Through secure messaging, we bring the member and their care team together through real-time secure messaging. Fully integrated within Epic, our nurses can receive, view, and respond without having to leave the Epic application.
So the challenge for Mozaz was how to merge our secure messaging functionality with Epic's email-style messaging infrastructure. Our solution was to embed secure messaging directly into the nurse's instance of Epic, also leveraging Epic InBasket to ensure no member message gets missed. Members on Condition Advisor have a very familiar messaging experience, like iMessage or WhatsApp. Nurses have the same experience accessible from within Epic, where we embedded secure messaging via a browser window using OAuth 2.0 via Smart on Fire. This allows nurses to easily access a message window to view the member's message history, respond, or initiate a new conversation. To ensure no member messages get missed, Mozaz leverages App Orchard's Send Message API to send new message notifications to Epic InBasket. These notifications are visible to all nurses connected to the member and include the new message as well as 5 previous messages for context. From within InBasket, the nurse can launch the member's message window with one click, respond, and also see a read receipt when the member has viewed their message. We also wanted to make sure member messages were automatically added to the member's chart, which was done via flowsheet rows through an HL7 interface and the HL7 V2 API. Finally, we wanted to make it easy for nurses to initiate secure messaging conversations with active Condition Advisor members. As the app is currently not available to all Accordant members, we needed a way to dynamically identify app users. By saving a smart data value when the member logs in, we were able to trigger the messaging icon in MyChart, quickly identifying those members who can receive secure messages.
So how many of us go to the doctor and have to remember to tell them what medications we're on, pull them up, what's our frequency, what's our dosage, etc.? Wouldn't it be great if we could just pull it up on our phone? Well, it gets even more daunting for members with rare conditions as they have to manage multiple medications and can struggle with adherence. Keeping track of it all just got a little bit easier. Both members and their care team can view and update the medication list. Through Condition Advisor, our members can now proactively set up daily reminders, ultimately enhancing their adherence to their medication.
So the challenge for My Medications was how members could easily view, add, or update their medications and share those changes to Epic. Our solution was to display the members' medication list from Epic, allow them to update the list, and share those changes back to their nurses. For members, we used AppOrchard's medication statement.search API to call and display the members' real-time medication list in Epic, including dosage, route, and frequency. Members can then make changes to their medications, either adding, editing, or removing the data. The updated data is shared back to Epic, where nurses review the changes, then enter the updates in the members chart. Once the medication list is updated in Epic, it is immediately visible to members in Condition Advisor. For nurses, the My Medications feature encourages and empowers members to take a more active role in managing their medications, resulting in improved efficiency for nurses by reducing the need to spend time reviewing and updating medication with members.
Routine health monitoring helps our nurses detect if a member is exhibiting signs of complications, giving them the opportunity to provide timely intervention and also reducing the likelihood of a costly hospitalization. Our custom trackers display dynamic clinical content based on key demographic data points such as age, gender, and condition. For example, someone who is a 10-year-old African-American male with cystic fibrosis doesn't necessarily require the same vaccines and screenings as a 65-year-old Caucasian woman with MS. Members can choose to track condition-specific symptoms such as balance issues or falls, or even keep track of and chart key comorbidity values such as their blood pressure or A1C values. This is not just a one-way interaction. So when members submit their responses, the system stratifies them as low, medium, or high risk, and also provides digital education messaging. This directs the member to online educational material and then also encourages contacting their nurse or their doctor. These tools together truly empower members to practice proactive self-care.
The challenge for Mozaz here was how to notify nurses of high-risk data that exceeds thresholds while adding tracker, vaccine, and screening data into Epic to update the members chart. For the solution, we focused on ensuring that nurses were notified when members submitted tracker or screening data that exceeded set thresholds. To do this, we leveraged AppOrchard's Send Message API to send notifications to InBasket. These notifications included the tracker screening data as well as next step recommendations. In order to make it easy for nurses to access tracker, vaccine, or screening data, our integration included the creation of encounters for each form submission. At the same time, member charts were updated automatically via flowsheet rows through an HL7 interface and HL7 V2 API.
So there's a lot of apps out there right now in the marketplace to support reminders, including medication reminders, doctor appointments, etc. Condition Advisor went a little bit of a step further. In fact, we added this feature so that our members don't have to navigate several different apps in order just to manage their health. With our reminder feature, members are able to create a schedule of things that they want to track, and the app offers helpful reminders to remain consistent with that routine. This can include things like taking your medication on time, their next specialist appointment, or even just simply reminding them to check their vital signs like blood pressure. So throughout the presentation, we've touched a lot on the member's point of view and importance to that member experience. Now let's dive in a little bit deeper around the importance of the Mozaz and Epic integration for our nursing teams. Full integration into the nursing workflow was the #1 requirement that we had for this build and this integration. We could get all the data we wanted from the member, but if we didn't make it easy for our nurses to receive real-time notifications, then it would be all for naught. This level of integration is truly a real differentiator that elevates this product within the marketplace and dynamically changes the course of healthcare in the digital space. Through the use of various Epic calls and workflows, Larissa and her team were able to integrate with Epic's InBasket, allowing nurses to remain in the system to easily access patient data and messaging. Nurses are alerted real time when our patient's clinical data is submitted through the app via that InBasket messaging, using priority settings for triage and encounter creation.
So one of the biggest challenges that one faces working with a business to consumer organization is balancing the needs of the end user or member with the needs of the provider or nursing team. Ultimately, the member is our collective top priority, but if the nurses can't or won't use the solution, we won't achieve our business goals. Our approach at Mozaz in our work with healthcare providers is to listen, learn, and support. For Accordant, we spent time working with the HIT team, listening to their current challenges and finding ways to solve those challenges while also ensuring a great member experience. The goal of our Epic integration was to support the existing nurses' workflow. We focused on Epic in-basket notifications to alert nurses, ensuring member needs are front and center. We embedded secure messaging windows to make responding to members fast and easy, and updating charts via flow sheet rows and to save nurses time and effort. As we continue to work and grow with Accordant, our journey with Epic is just beginning.
So far, we've deep dived into our Condition Advisor app and kind of give you the ins and outs from the member experience and the nurses experience. You've also heard a lot about the omni-channel approach and how our members are connected with their nursing team. So now let me show you a real case example of how it all works together. Meet Jacob. He's 7 years old and his mom, Teresa, is his caregiver. She has a lot going on with work, being a mom, and everything else in between. She needs a little bit of help staying on top of Jacob's medications and identifying signs and symptoms of his complications before it comes down for a need to go to the ER. So in this case, Jacob was recently hospitalized due to a buildup of mucus in his airway, common with CF. Upon discharge, Teresa got a text message letting her know that her Accordant nurse, Thomas, will give her a call tomorrow to discuss the discharge instructions, go over medication updates, and discuss any other questions that she or Jacob may have. Thomas connected with Teresa and went over some new airway clearance techniques to help minimize Jacob's buildup in the future. Thomas then encouraged Teresa to download the Condition Advisor app to track symptoms and view and update his medication list at any time. A few days later, Teresa did just that. She went on Condition Advisor and read up on the airway clearance technique that Thomas told her about, which was coughing and huffing, just to make sure she was doing everything correctly. While on the Condition Advisor app, she also used the CF symptom tracking tool to log his progress. She picked up some new medication for him just the other day, so she went to the medication list and added that in there too. All in one app, hasn't had to leave it yet. A few days later, she noticed that the coughing and huffing technique wasn't clearing out as much of the mucus as she thought it would. So she went back on the app and sent Thomas a secure message asking about the other techniques she can use. Thomas got that alert real time within Epic, so he quickly replied with a response that also included links to videos and articles and other techniques she could use. What this case example really shows us is how the omni-channel experience support and empowers our members with rare conditions to transform their behaviors and positively impact clinical outcomes. Teresa now feels confident in her management of Jacob's condition, and through this omni-channel approach has strengthened her relationship with her nurse, Thomas.
As Danielle just described, interoperability is key to a successful omni-channel experience. Working with any EHR is challenging, and Epic is no different. Every Epic instance, including Accordance, is tweaked and customized, making integration challenging, as Epic's test sandbox environment is not identical to the Accordant production environment. As a result, this project required flexibility and coordination between Mozaz, Epic, and the Accordant IT team as we designed, tested, and iterated our way to a final solution. As part of this process, we challenged accepted paradigms and weren't afraid to break the system to build a better experience for members. That solution included leveraging AppOrch's APIs to send Epic in-basket notifications to nurses, HL7 interfaces for writing flowsheet rows to member charts, and OAuth for onboarding and secure messaging integration. How did we arrive at our solution? It was through close collaboration between Mozaz, Accordant, and Epic, sharing knowledge and expertise. Also, through our strong alignment on goals and a clear focus on both members and nurses as key stakeholders in the project. Finally, just because you build it doesn't mean they will come. Condition Advisor is just one of Accordant's omni-channels, incorporating marketing strategies to grow adoption. Condition Advisor and its Epic integration will continue to grow and evolve as we learn from our members and nurses, never satisfied and always aiming to improve member experience.
Thank you, Danielle and Larissa, for that insightful presentation, and thank you so much to our virtual audience for listening in. If you'd like to follow up with any of us, you can find our contact information on this slide. This recording, as well as the slides, will be available at the conclusion of today's event. Let's move over to our live Q&A session. At this time, if you have any questions, please enter those into the question box on the attendee panel. We will get through as many questions as we can. If for whatever reason we can't get to your question today, we will have someone follow up directly after the webinar is concluded. So let's get started on the questions. Looks like the first one is for you, Danielle, and the question is, how is the integration into MyChart working for the nurses?
Yeah, great question. So with the use of OpenID, as Larissa mentioned throughout the presentation, we are able to seamlessly integrate not just the nurse's experience, but also the member's experience within that. That helps from the nurse's perspective because they're able to utilize the same features within Epic to, let's say, activate MyChart as they would the Condition Advisor app. Nurses are also able to seamlessly toggle between any MyChart features as well as any Condition Advisor features such as secure messaging within Epic without having to leave Epic or leave that platform. So our nurses find it relatively easy to navigate both the MyChart systems as well as the Condition Advisor alerts, simply because Mozas has done such a great job in with partnering with our Epic team to integrate seamlessly into the nursing workflow within Epic.
Great, thanks, Danielle. And I remember in our discovery and requirements phases in the very beginning, that was one of the things that you had mentioned. We had to take into consideration the ease of use for your clinical team as well. So I'm glad we're able to accomplish that. Larissa, looks like I have a question for you. Which of the features shown today was the most difficult from an Epic integration perspective? And you only get to choose one.
That's a good question. Gosh, I would have to say from an integration perspective, secure messaging was the most challenging. Supporting the current nurse workflow was a major concern, and we've kind of identified that throughout, and required that we embed the messaging window into Epic. This in turn required dynamically authorizing the nurses whenever they launched the window. So that was a bit of a challenge for us. Finally, we needed to ensure that when the member sent a message, the nurses were notified. And that was a big thing as well, because we did not want any member messages to be missed. And it was very easy to and also at the same time to make it really easy to understand the context of the conversation and reply. So definitely from kind of a multi-part implementation piece, that was probably the most difficult to integrate. But from a product perspective, it was actually the most fun problem to solve. Yeah, it was challenging, but I think we did just such a great job, and I think it was a lot of fun.
Great. Yeah, and the teams work so well together during this whole process and sharing ideas and going back and forth. So we appreciated, the openness of Accordant and our team as well to create a great product. Danielle, do you have anything to add to that, or did she summarize everything up for you?
No, Larissa did a great job summarizing it. We have found that the use of secure messaging is key for our members. They like that feature. They utilize it pretty much, we would say, more than anything else. And our baseline here was just, even with MyChart, quick access to their care team, sending questions, getting those responses back. That's how we all live and work. I mean, how many text messages do we send out to our friends and family a day, and even via email to our colleagues? So getting that right, to Larissa's point, it was a challenge. It was difficult getting us there, but we are very happy and satisfied at the end of the day with the results, and our members are utilizing that feature at the rate that we expect them to. So it was a win all around.
Perfect. Hard work paid off. That leads me to the next question, which is a nice tie-in. How do you manage members who are actually using MyChart, Danielle?
Yeah, so that is a great question. I would say liken it to the difference between your LinkedIn mobile app and your LinkedIn desktop, that you go to each one essentially for different features. And that's how we're directing our members today. We wanted it to be a seamless experience, hence the Open ID, as we mentioned before. So our members can utilize their same username and password, but we wanted the features to be distinct, but also together. What I mean by that is on the Condition Advisor app, there are very unique features specifically for mobile app usage. Some things work better on a desktop. Again, going back to LinkedIn versus your desktop version of LinkedIn versus your mobile version of LinkedIn. They're two different features. There's two different user experiences. Symptom trackers, for example, our secure messaging is another good example where it's formatted more of like a chat than an email. These are things that are great on a mobile application right there in your fingertips, essentially in the palm of your hand, versus things like your after visit summaries, which is unique to Epic and MyChart, or even MyChart's messaging platform, which is more like email where you can send attachments and things like that. So in our marketing materials, as we're having conversations with our nurses, we make that distinction and point them correctly to the different mobile and desktop applications as appropriate.
Well, it sounds like you took everything into consideration and, you're moving forward. So that's amazing. I think the next question is for you, Larissa. Can you elaborate on how automation plays a role in this application?
Sure, I can definitely do that. Just to piggyback on what Danielle was saying, I think what Accordant is experiencing, and certainly what she described, is where we're seeing the entire healthcare space going, which is this idea of being where the member or the patient is and providing that information optimized to the platform or environment that they're in. So I think Accordant's doing an amazing job. It's so exciting to work with an organization as forward thinking as them. So that's been a lot of fun. Back to the question about automation. So automation is actually a real strength for us at Mozaz. Danielle kind of mentioned it throughout the presentation, and I didn't really speak to it that much because it is something that is so much core to what we do. And it's not really something that we would speak to in terms of kind of like that Epic integration. But what it is it allows us to really take any data source, be it an external API, a form submission, connected device data, and use that to trigger specific actions or events, such as questions, alerts, content for anyone or to anyone within the platform. So be that a member, a nurse, or a business user. This kind of flexibility and configurability is at the heart of Condition Advisor is kind of engaging and personalized user experience. And what we also can do is the flip side of that coin is it allows us to support the needs and the workflow of the user. And another piece, just tying it back to Danielle's question before, which is her answer before, is around the idea that this automation is platform agnostic. So it really is about triggering that activity, action, or event on whatever wherever the member or user is, be that desktop or an app or SMS. So I think that's that kind of flexibility that allows it to be customized and personalized to the user.
Thank you, Larissa. Danielle, did you have any comments to that? Or I think Larissa covered most of it, but I did want to give you an opportunity to add on.
Thanks. No, I think Larissa covered it. I echo everything Larissa said.
Great partnership. The next question is for you, Danielle, and this more focuses on the business perspective. How does an organization partner with Accordant?
Oh, well, that is a great question. We welcome all new inquiries and clients and partnerships. So if you are interested in any of the above, you can send our sales team an email. Their email is care_management care_solutions@cvshealth.com, excuse me. And I'll repeat that. That's care_management_solutions@cvshealth.com. And you can also find out more by going to accordant.com on your web browser.
Great, thank you, Danielle. I have another question for Larissa. What about Condition Advisor app feels unique versus the other applications that Moses has created?
Unique, gosh. Okay, yeah, that's actually a good question. So I think overall, Moses specializes in patient engagement applications, with, I think, Condition Advisor just being one of our more innovative white label solutions and targeted to a very diverse member population. So I think that's key. I don't think it's necessarily the most diverse, but definitely some very distinct groups that, of course, Danielle talked about. In terms of the number of conditions that we're supporting, and also demographic data that we use to further customize and personalize the experience. But Condition Advisor really allowed us to flex a few of our engagement muscles, including that personalization that I talked about, and also the opportunity to be able to embed a team-based secured messaging, which I think is really cool. Because one of the things that is sort of unique to Accordant is this kind of team-based nursing approach that they have. So what we really wanted to be able to do is we wanted to be able to provide the member with an opportunity to securely message their nurses, but also to be able to support the idea of the nurses being able to view, being able to interact or not, depending on the circumstance, and always being able to be up to date. And so that experience is quite unique, and it was an opportunity for us to sort of have some fun and solve some interesting problems. And there's still lots more to come, so it's very exciting.
Yeah, no, I appreciate that. Thanks, Larissa. And I look forward to the future with Accordant. I know we've got the plans for the next year or two on where we want to take this application. And I'm not sure if Danielle wants to share any further details about that, or we'll just have a wait and see. What do you think, Danielle?
No, moving into the future is always on our minds, right? We have to stay up with the times and constantly innovate. As we're looking at the future enhancement roadmap for Condition Advisor, as we move from our pilot phase, we are looking to integrate further within Epic, utilize some of their core features, such as Cadence, which is Epic's nurse scheduling program, integrate a little bit more around wearable devices, and also just enhance that nurse member interaction. How can we get a little bit more personalized? How can we get a little bit more dynamic in the messaging that we're sending, or the clinical data that we're displaying to our members? So this is a long partnership, and we look forward to it.
Great. I appreciate all of your feedback, and that's great. I think that is probably all the questions I have on the list. I'm going to give each of you ladies an opportunity just to make some final comments or thoughts. Larissa, did you just want to make a closing comment or your thoughts on this whole process if I haven't covered everything off today?
Yeah, I think this is the opportunity to work with Danielle and her team at Accordant has been probably some of the best experiences I've had in my career in terms of just such an open and transparent relationship. Working with the nurses is wonderful, and it provides that opportunity that someone in product doesn't always get, which is the opportunity to really solve some interesting problems and feel like you're making a positive impact. I would also like to shout out to the Epic experts that we worked with as well. Again, can't stress enough, Epic is a huge application, and we were able to take the pieces that we need and to solve some really big problems. And so it was a fun challenge, but it's obviously hugely worthwhile, as interoperability is such an important part of what Accordant is trying to do, and of course what Moses is trying to do. So I think in the end, what we've created is something that's great, great member experience, great nurse experience, but it's just the beginning. And yeah, I'm super excited for where we're going to go next.
Well, I don't know what else to add to that, Larissa. She summarized
Mic
it very
drop.
well. But but basically, to echo what Larissa said, this has been a very, very wonderful relationship between Epic, Mozaz, and Accordant. I think, Larissa, you're selling yourself short here. We gave you a huge problem to solve and requirements of that interoperability. And we at Accordant like to kind of break the system a little bit and go outside of the mold, because at the end of the day, our members and our in that member experience and that connectivity to our nurses is what really supports our program. Making actionable changes, supporting members' health, really allowing our members to feel empowered and giving them the education and the resources that in the healthcare marketplace don't exist for these rare conditions. That was the aim of everything that we were doing with our digital strategy, with the creation of Condition Advisor. And that meant that Epic and Mozaz, we had to transform it in the way that our members and our clients expect. So, truly echo Larissa's comments around the Mozaz team and the Epic team taking on that challenge and seeing how we can take some of those core elements and then also customize them, mold them. So again, the member experience is centered, that nurses experience is centered, and we're able to truly connect and create a digital platform that, again, doesn't exist for these members, and really truly create something that will transform healthcare, that will transform the way that these members interact and support themselves with their condition. So thank you all for all of the hard work in bringing this to light.
And thank you, Danielle and Accordant team, for entrusting us with this important endeavor. And it's been definitely unique. And thank you to everyone in the virtual audience today. And please feel free to contact any of us with any additional questions. And with that, Garrett, I'll let you take it over for here and finish everything up.
Great. Well, thank you all so much. This is a wonderful presentation, and we did have, by the way, we had a lot of questions that came in that we didn't have time for today. So don't worry, we will get to your questions, and we'll respond to you via email. So even if you have something last minute that you want to ask, please do that. And again, I wanted to thank you to our presentation team today, and encourage everybody, if you want to learn more about Mozaz, if you want to connect with them further, if you visit our virtual exhibit booth, or their virtual exhibit booth at acoexhibithall.com. And this would be a place where you can connect with their team and learn a little bit more about them and watch some informational videos. And there's a lot of interactive components there in the archive library. And also on acoexhibithall.com is where we will be archiving this recording. So you'll be able to access in our library this webinar and others for your research and entertainment. So thank you so much again for visiting us today and joining us. Lastly, if you have any specific questions for any of our speakers or any of the Mozaz team, feel free to reach out to them. I believe their contact information is in the slides. And again, I will send out a link to all of you to the recording and the slides after the presentation today, and then you can see that there. So thank you again so much. Hope you have a wonderful rest of your day. Thanks for attending. Goodbye.